Hi, my name is Amal. I'm a mother of 4 children, all patient of Dr. Linda at Ashburn Children Dentistry. This is baby Sophia. She is currently receiving Babylase treatment by Dr. Linda at Ashburn Children Dentistry, and to help with proper latching during breastfeeding. Initially, when I started breastfeeding baby Sophia, she can latch okay, except that she slips out quite a lot and make like a clucking sound as she's nursing, like as she nurses, and often get too tired of nursing and she drops out of the breast. So Dr. Linda recommended Babylase treatment for her. The first time we received the treatment, I noticed instantly that she is able to nurse for a longer period, so more minutes, and she's still clicking, that clicking sound with her tongue, except that it's not as frequent as the time before. She's latching better, but she's still slipping off. By the second time we received the Babylase treatment, her clicking was not per feeding. It happens still, but not per feeding. Before, it's every feeding she would click, but after the second treatment, she would still click, like I said, but not at every feeding. Maybe still weekly, but not per feeding, which was a huge surprise to me, that Babylase can make results show that quick just from the first treatment, and by the second treatment I seen result. By the third one, her click actually stopped. I don't hear any more clicking during feeding, especially if she latch appropriately. She's still slipping off the breast, but nearly not as frequent as before. With my assistant of holding the breast, she does wonderful. She's definitely nursing better and not falling asleep every time she nurses, which I learned from my treatment with my other boys with Dr. Linda, that falling asleep is sometimes a sign of them working so hard to nurse that they're just so exhausted they fall asleep. So you can see here's baby Sophia. She is turned 3 months yesterday. Oh no, September 3rd was exactly 3 months, and you can see she's doing wonderful and gaining a lot of weight. She looked more, I don't know if the camera does justice, but she looked, put your dress down, that's not appropriate. She looked more older than 3 months. I think she looked more like a, I don't know, 4 or 5 months old, but I don't know if you can tell from the video. But she's nursing very well. I am confident that my milk will continue for a little longer. At first I had the fear that it was going to go away. Now I feel very secure that we're going to nurse a little longer, right, baby Sophia? And in fact, when Dr. Linda recommended Babylase treatment, she performed it on me first to help me understand what is Babylase. Because like I stated earlier, I have never heard of Babylase treatment before. I heard of it for older kids from Dr. Linda with my 9 years old and 7 years old when they needed to receive it for their myofunction treatment, but I did not know babies can receive it too, and we can early intervene at a newborn age or at this young. So Dr. Linda performed the LASIK treatment at me. There's part of the treatment, they've asked me a few assessment questions to understand where are my tightness or sore points in my body. Things like in a scale of 1 to 7 or 1 to 10, I think 1 to 10, describe your pain or tightness in your shoulder or in your cheeks, like here, or on your neck. And so I nurse while I'm laying down sometime. Not a good position for nursing, but it's something that helped me survive through the night. And I nurse the baby in my right side with the head resting on my arm. So my neck tend to have tightness from that position, and at my shoulders as well. And Dr. Linda performed the LASIK treatment on my neck, my shoulder, even my jaw, and the side where I nursed was more tight than my other side. And instantly, my pain level for my neck and my shoulder was 6, And I told them 6, but I really was feeling more like a 7 and 8. I think I was just trying to be not as vulnerable. And it was wonderful. As soon as she did the LASIK treatment, my pain level was 0, which I couldn't believe it, because I would pay so much money for. I always suffered from shoulder and neck pain, but it got worse since I became a mom. And as I mentioned, I have 4 children and my oldest is 9. So I've been suffering from severe pain in neck shoulder for many years. And the LASIK treatment just made it go away, like immediately after, which like miracle. And I realized all this money I paid for massage therapy, and I went to chiropractic before trying to get rid of my treatment. And it improved it, but it never went away like immediately like that. It takes few sessions, and then even then it minimized it, but it never disappears. So when Dr. Linda did the LASIK treatment and it disappeared, I was like, where were you my whole life, Dr. Linda? This is amazing. So in all seriousness, I highly recommend baby LASIK treatment for your children. The earlier, the better. Watching the development of my 9 years old and 7 years old after the treatment, and then watching my 2 years old starting younger than them. Starting younger than them and seeing the benefit of early intervention, I highly recommend it. And our families